Today I will tell you about specific subdivision of central neuron system, which named autonomic neuron system. And first of all, you should understand specific functions and differ between two branches of central neuron system. All our brain spinal cord functions divide on somatic and visceral. It's two branches of central neuron system. And difference you might find in this slide may be, first of all, in histology, because even in prenatal development in our body, some cells in brain and in spinal cord produced from different tissues, from different parts of placenta. You see somatic part, somatic division of central neuron system provide from mesoderm, and visceral part cells generate start development from slight differ region from endoderm. Next, differ in functions. Of course, most important, most valuable for you understanding specificity in functions. In somatic neuron system, we tell about voluntary function, its ability for movement our arms and legs, its contraction of skeletal muscles, its locomotion. All these processes is voluntary, and visceral neuron system realize regulation of our inner organs, vessels, regulate blood pressure, and all these functions involuntary. You could not control these processes. For realizing these involuntary functions, visceral neuron system connect with cardiac muscles, smooth muscles, with endocrine glands. All these components of our body realized involuntary control and activity. Next, in autonomic neuron system, we have again new branches, new subdivisions. It's sympathetic and parasympathetic branches of autonomic neuron system. They have some common functions and specific functions. Common for both sympathetic and parasympathetic branches, it's realizing homeostatic regulation in our body. Homeostasis is some constants in our body parameters, like, for example, glucose level in blood, pH level in blood, blood pressure, and many other parameters which may vary, but if they significantly changed, it lead to imbalance our homeostasis and may lead to disorders and even to death. That's why for surviving, for normal realizing all our kinds of activity, we used control of this homeostasis. Next, it's a response to external stimulus, especially stress. And last common function, it's endocrine regulation for many functions of our body. It's stress response again, and additionally very important regulation for reproduction. Our sexual activity realized with help of sympathetic and parasympathetic neuron systems. Terms sympathetic and parasympathetic, it's Greek words, and from Greek language, sympathetic you may translate like together with suffering, together with some senses. Sympathetic. It means that all our senses, all our emotions associate with sympathetic regulation. When you feel some strong emotions, good emotions or bad emotions, when you feel some external stimulus, especially if it's strong stimulus, maybe painful stimulus, all this activation lead to increased sympathetic activity. And next term, parasympathetic, again, it's from Greek language, and para, its opposite or beside, other than sympathetic. So parasympathetic, it's quite new term. There was introduced later comparing to sympathetic, and all functions which not associate with senses, with emotions, we named parasympathetic. You should know about anatomy of autonomic neuron system. And autonomic regulation in our central neuron system realized in three layers. First of all, highest level of regulation for inner organs activity. It's our diencephalon. On next lesson, I will tell you about this term. But now you should know about localization in our brain in several levels. Hypothalamus, one of most important region in diencephalon, associate with activation of sympathetic neuron system and parasympathetic neuron system. It's a highest level for regulation. Next level, localized in brainstem, in spinal cord, and its centers which divide on two branches. If in hypothalamus, we may say this region in brain realized all regulations for autonomic activity. In next level, we divide specific centers for sympathetic activity, like spinal cord, thoracic level, for example, and parasympathetic centers like brainstem, for example, where localized neurons send impulses for next third level. And third level, you may see it's enteric neurons. What it means? It's neurons which place far away from brain and spinal cord. These neurons localized in inner organ, in neural plexus, in ganglions around inner organs. And these neurons realized fine control for some specific organs. Again, usually we may divide neurons which realized sympathetic activity and neurons which realized parasympathetic activity. So these three levels today we discuss, and I show you specificity on all levels. First of all, we will tell about highest level of regulation, about hypothalamus, because hypothalamus it's a homeostatic center in our brain. It's a region which realized all kinds of homeostatic regulation. For this control for regulation of homeostasis, hypothalamus have several properties and ways for regulation. First of all, hypothalamus send impulses to sympathetic and parasympathetic centers. That's why we tell about hypothalamus like highest level for autonomic neuron system regulation and control. Beside it, hypothalamus associate with control of endocrine glands. After a few weeks, I tell you about endocrine system, about hormones which produced by different organs, and all these endocrine organs regulate from hypothalamus. So it's not only neural regulation. Hypothalamus is highest level for endocrine regulation, and it's very important because it's like two arms for better control. One arm is neural regulation, second one is endocrine regulation, but they help for common way for maintain homeostasis in our body. On next level, when we divide neurons and centers in our brain and spinal cord, we tell about sympathetic and parasympathetic centers. And for easily memorizing, you may use this abbreviation. In English language, we tell about 4F function in autonomic neuron system. Two of these F functions belong to sympathetic neuron system. With activation of sympathetic neuron system, we realized fight or fly away. And two functions realized with help of parasympathetic system. It's feeding and fooling. Or in some sources, you may find other interpretation, rest and digest. I hope it help you easily memorize main functions for sympathetic and parasympathetic neuron system. Of course, we will return to these functions today many times, but you should know all differences and all specificities in regulation for autonomic activities. And this specificity start not from functions, they start from anatomy, position of neurons, and types of neurons. You may find in this slide sympathetic and parasympathetic neuron system realize the activity through two motor neurons. In previous lecture, when we tell about reflexes and reflectory arc, I tell you about three components of reflectory arc. It's afferent neuron, interneuron, and afferent neuron. Afferent neuron, which send impulses to muscles or glands, start from central neuron system, and action of this afferent neuron came to organs, to muscles, or to glands. It's only one neuron for somatic neuron system, long axon from neuron, the body placed in brain or in spinal cord. For autonomic neuron system, you may find it's two motor neurons. One neuron localized in brain or spinal cord and send axon to ganglion. In ganglions, second neuron localized which send impulses to our smooth muscles or cardiac muscle or to gland. That's why we tell about two autonomic neurons. Usually specificity only in afferent pathway. Afferent near the same together with sympathetic, with somatic. But afferent pathway quite differ and divide on two branches, ganglionic neuron and postganglionic neuron. Ganglions may be differ in sympathetic and in parasympathetic neuron system. Ganglions for sympathetic neuron system named paravertebral or prevertebral. It means they localized near the spinal cord. Para, it's beside. Pre, it's before. And on this picture, you may find examples of sympathetic ganglion, prevertebral, paravertebral ganglions, and second neuron localized near the spinal cord. So first preganglionic neuron is small size, and second one, postganglionic neuron for sympathetic neuron system is long. They need provide long length for inner organ. And in parasympathetic neuron system, opposite situation. It's like terminal ganglions, for example, or intramural ganglions. They localized near the organs, and as a result, prevertebral neuron, preganglionic neuron in parasympathetic neuron system is long, and postganglionic neuron is very small size. They localize near inner organs or in the walls of inner organs and vessels. Next specificity in innervation, which our inner organs may innervated by sympathetic and parasympathetic subdivisions of autonomic neuron system. You may find it's many inner organs, and most of our organs realized innervation from both sympathetic and parasympathetic branches of autonomic neuron system. It's gastrointestinal tract, it's respiratory tract, it's heart, many glands, but some exclusions we have in this common rule. Like, for example, small vessels, arterioles, realized only sympathetic innervation. Our vessels not receive impulses from parasympathetic neuron system. Skeletal muscles realized parasympathetic innervation, but not, realized sympathetic innervation, but not parasympathetic. Salivary glands realized mostly parasympathetic innervation. Adrenal glands realized only sympathetic innervation. That's why we have some organs which have only one type of innervation or prevalence in innervation. It's not balanced between sympathetic and parasympathetic branches. Next, differ between these two branches in localization of preganglionic neuron. Motor neuron, first motor neuron, which send impulses from our central neuron system on periphery. You may find in this picture common differences in anatomy and localization of this preganglionic neuron. For sympathetic neuron system, these neurons localized in spinal cord, in thoracic level and in first lumbar levels of spinal cord. We have neurons which send impulses to sympathetic ganglions. This is sympathetic regulation. And parasympathetic neuron system occurring impulses from hypothalamus, but neurons localized in two centers. Not one like for sympathetic, two centers. First is cranial center. They localized in brainstem and medulla oblongata, and most important region, it's center for vagal nerve. They send impulses for most amount of our inner organ. And second center is sacral center. They localized in sacral part of spinal cord and send impulses only to bladder and to sex organs, male and female sex organs. So this center control only sexual activity and excretory function. Again, memorized your differences in anatomy and structure. Even by localization ganglions, we may understand which part of autonomic neuron system realized this type of regulation, because sympathetic regulation, it's short preganglionic neuron. For parasympathetic, it's long preganglionic neuron. But these neurons have not only differences in length, but additionally they have differences in neurotransmitter, because in ganglion we have synapses, chemical synapses for communicate to neurons, and in these synapses produced neurotransmitters. I tell you about synapses and neurotransmitters in previous topics, so please memorize what it means. And may differ, you may see in postganglionic neuron. Preganglionic neuron in both sympathetic and parasympathetic neuron system produced neurotransmitter which named acetylcholine. And in postganglionic neurons, we have receptors which named nicotininergic receptors. Its specific subdivision of receptors which activated by acetylcholine. On postganglionic neuron produced different neurotransmitters. In parasympathetic neuron system, postganglionic neuron produced again acetylcholine, but receptors in inner organs, in smooth muscles, differ. It's muscarinergic receptor. So in ganglions, it's nicotininergic receptor. In organs is muscarinergic receptor. And it's very important for regulation. We should use different medicines for control activity of neurons and for fine regulation in some specific disorder. Okay, in a sympathetic neuron system, you may see postganglionic neuron produced other substance, other neurotransmitter. It's not acetylcholine, it's norepinephrine. And receptors for norepinephrine, many types of receptors, they divide on two groups, alpha and beta, and every group have subgroups, alpha 1, alpha 2, beta 1, beta 2, adrenergic receptors. All these receptors activated by norepinephrine. Only one exclusion in our sweat glands, sympathetic neuron system work similar to parasympathetic, because postganglionic neuron produce not norepinephrine but acetylcholine. All other postganglionic neurons in sympathetic neuron system produced norepinephrine. And again, you may find differences in innervation. It's quite a big problem for students. That's why you should memorize this better for exams. In sympathetic neuron system, innervation is wider compared to parasympathetic. Some organs and tissues have only one type of innervation. Usually it's sympathetic. And some organs like skeletal muscles, vessels, skin have no parasympathetic innervation. And now we came to functions, to specificity in functions between sympathetic and parasympathetic regulation. In common for easier understanding, sometimes you might find in literature about sympathetic neuron system like activatory system, parasympathetic like inhibitory system. That's why we tell about fight or flight, activation from sympathetic, and rest or digest for parasympathetic neuron system. But in general, it's easily for memorized, but not absolute. Not all organs and systems activated by sympathetic and inhibited by parasympathetic neuron system. For better understanding, I used this mnemonic rule. If you imagine some stressful situation when you are in dangerous and should escape from this danger, in your body for escaping from dangerous, increased some organs and systems activity. First of all, increased cardiovascular activity, because your blood should faster transfer oxygen and nutrition to muscle. Muscles should receive more energy for escaping from dangers. That's why in this system, activation of sympathetic neuron system lead to activation of cardiac activity, heart frequency increased, blood pressure increased due to vasoconstriction, diameter of vessels will decrease. This cardiovascular system will activate it. And second one, respiratory system will activate it too. For receive more energy, you should receive more oxygen. That's why with help of sympathetic neuron system, your lungs will make more respiratory cycles in every minute. Your bronchs and bronchioles will dilate for easily transferring more air in length. But next system, digestive system, is inhibited. This is one of examples why in nowadays we don't say about sympathetic neuron system like only activatory system. So digestive system inhibited, and activity of smooth muscles in stomach, in intestine decreased, production of enzymes in gastrointestinal tract decreased, and all this system inhibited. And this is highly important because for surviving, you should decrease the amount of energy which you spend for digestion and give all this energy for your muscles. That's why normally sympathetic activation lead to decreasing activity of digestive system, excretory system, and sex organ. Additionally, sympathetic activation lead to change our skin, and you may find increase in sweating during stress situations. It's a result of dilation, increased blood supply for skin vessels. It useful for removing heat from our body. You know, when muscle contract, when you escape from danger, your muscles produce more heat, and with vasodilation in skin, this heat may easily removed from our body, usually with sweating. That's why typical for sympathetic activation, it's activation of sweat glands in skin. You may find additionally pillar erection, but in humans body, it's not very significant situation. Pillar erection, it's contraction of pillorium muscles, which rising hair. But you know, our hair not so good like in animals. That's why this pillar erection not lead to some significant changes. Additionally, some inner organs and glands activated by sympathetic neuron system. First of all, I tell about adrenal glands. These glands realize production of epinephrine and norepinephrine, and two hormones, epinephrine and norepinephrine, work similarly to sympathetic neuron system. It's like additional way for increasing strength of activation by sympathetic neuron system. When impulses from sympathetic neuron system reach adrenal gland and two hormones produced in blood, you may find additional and very significant increase in blood pressure, heart rate, and all other sympathetic effects. But interesting question. You remember I told you previously, sympathetic neuron system realized two effects: fight and fly away. Fight is angry, it's strange reaction, and fly away, escaping, it's not associated with such kind of strong emotions. But why some situations and some persons in general have tendency for fight response? You know, they may be more aggressive, and some persons have tendency to fly away response. Actually, it's due to adrenal gland and two types of hormones, like I told you previously, epinephrine and norepinephrine. Because increased level of norepinephrine give tendency to produce strong response, fight response. Person became more aggressive, and more epinephrine have better chances for fly away, not for fight. Additional specificity for sympathetic neuron system, it's many types of receptors. I told you previously about alpha 1, alpha 2, beta 1, beta 2, beta 3 receptors. It's many types of sympathetic receptors to norepinephrine. And many types of receptors realized different responses. For example, you may find beta receptors, especially beta 2, may lead to muscle relaxation, vasodilation, increasing diameter of bronchiole. So these receptors block muscle activity, and it may be important for those organs which should decrease muscle activity: skin, lungs, bronchiole. Opposite situation with alpha adrenergic receptors. especially alpha 1, which mostly provide activation of smooth muscles. And those organs and tissues which have more alpha-adrenergic receptors realized with activation more contraction of smooth muscles.
Yeah.
I hear somebody very active. Please tell me, do you know who is this? You know, he was a great warrior.
Yes, sir.
Yes.
And
And
all over.
he win all wars except two. He failed in India and in Russia. In ancient time, of course, there is no India and Russia, but on those places where he failed, in nowadays, these two countries. But all other fights they win because they have very good soldiers. And historic anecdote was about rules for selecting good soldiers. Alexander look on this on person's face and say, for example, for his bodyguards, kill him. It's stress for person. Nobody like when they was killed. But two types of behavior in this stress situation: fight and fly away. These reactions may associate with color of skin. For persons who have more norepinephrine, you may find mostly vasodilation in face, and face became a red color. For persons who are afraid some situations, vasoconstriction in skin take place, and skin became pale. And Alexander the Great select for his warriors only soldiers with first type of response, those whose face became red in stress situation. We say when these persons in stress, they had received more blood. They can better blood supply for brain, and I need persons who didn't left his brain during stress. That's why by history Alexander have good warriors, because he select only those who realized fight response, not fly away. But nowadays we again use in knowledge about sympathetic activation for some organs, and even in language, especially in Russian language, we have two words which look similarly: sympathetic and sympathичный. Sympathичный, it's nice looking. Tell me, please, this puppet is nice looking or not?
Nice looking, sir.
But why you decide this? Could you explain?
Because it is attractive, it is shiny.
But why? What's most attracting in this puppet?
Its eyes.
Eyes.
Yes, big eyes. Yes, dark eyes, and
Its color.
reddish cheeks. Yes, you see them?
Yes, sir.
And actually,
Yes.
in many cultures, you know, we have different cultures in different countries, but you may perform this experiment. I provided many times with students from other countries, and all say it's nice look because it's universal for all humans. And you know, these two symptoms for nice looking person associate with sympathetic activation. With sympathetic neuron system, our iris in eye dilate, pupil in eye dilate, and eyes looking bigger and darker. And like in my previous example with Alexander the Great, increased blood supply for skin and face produced reddish skin on the face. And actually, it's associated with our biological culture, not with something else. We think that these persons who have slightly symptoms of sympathetic activation, nice looking. Why? Because if a person has ability for increased sympathetic activation in stress situation, this sympathetic neuron system give for him ability for escape from danger. That's why when you find your boyfriend or girlfriend, you select nice looking persons, and its biological behavior for reproduction, for producing new babies. It's better when as father, as mother can easily escape from danger. You understand this? And in nowadays, many millions of dollars in around the world spent for producing fake sympathetic response. I mean makeup. You know, it's similar to previous discussed topic. Nice looking makeup. It's always increased visual increased size of eyes. Yes, eyes became darker. Increased color of lips, of cheek. It's absolutely similar to sympathetic response. And with makeup, girls usually, of course, realized a response similar to sympathetic neuron system. Okay, next it's parasympathetic division, parasympathetic neuron system. They associate with several centers in our brain and spinal cord, but most important, most valuable, it's vagal nerve and nerve of tractus solitarius. Parasympathetic neuron system came from neural centers from this nerve. As I told you previously, they localized in medulla oblongata, and from medulla oblongata they came to many different organs, and in organs realized ganglions, intramural ganglions, terminal ganglions, except our sex organs and excretory organs like bladder. This region, these organs innervated from a sacral part of parasympathetic neuron system. That's why in some literature you may find other name for parasympathetic neuron system. It's craniosacral neuron system, because two centers, cranial centers in medulla oblongata and sacral centers in sacral region of spinal cord. Previously, I demonstrate you that sympathetic and parasympathetic activity are not so simple. We could not say that sympathetic neuron system always activate organ, and parasympathetic neuron system not always inhibit organ. In some literature, especially from previous century, you may find about reciprocal activity. It means that those organs which inactivated by sympathetic neuron system inhibited by parasympathetic, and vice versa. It's better, but again, it's not always true, because we have some exclusions from this reciprocal activity, and we have examples of complemental activity, when as sympathetic as parasympathetic neuron system need for work together and for improve efficiency for some organs, for some functions. Most well known, it's two examples of complemental activity. It's our salivary gland activity, because salivary glands produced two types of saliva, very liquid, only water by parasympathetic neuron system, and only enzymes with sympathetic neuron system activity. But for better realized digestion, we need and water and enzymes together. That's why better digestion realized when our salivary glands in same time produced activation as from sympathetic, as from parasympathetic neuron system activity. And second example, it's processes of excretion and reproduction. Excretory organs and reproductive organs, especially in male reproductive system, work better when activated together with sympathetic and parasympathetic neuron system. Only activation of parasympathetic neuron system don't give ability for micturition, defecation, ejaculation. Only sympathetic neuron system activity. Again, not useful. They don't give ability for peristaltic, for producing more urine, for produced more sperm. That's why it's complemental activity, and these organs, excretory systems, sex organs, salivary glands, for better activity should be activated in same time as sympathetic as parasympathetic branches of autonomic neuron system. And in general, we may say about common function, it's making homeostasis, making accurate control for all organs from combination of sympathetic and parasympathetic activity. And for better understanding this, we may find situations when sympathetic and parasympathetic regulation imbalance. For example, in stress, I told you previously, we need activation of sympathetic neuron system. Yes, if this system activated, they realized fight or flight response, and it may lead to success. You escape from dangerous. It's very good. But if sympathetic neuron system overactive, they may produce more activated activities than you need. And this may lead to some disorders, like, for example, panic attack. Every slight stimulation may lead to dramatic response, very high blood pressure, very high frequency of heartbeats, frequency of respiration, and so on. And opposite situation, if sympathetic neuron system activated not enough, and during stresses, mostly activate parasympathetic neuron system, it may lead to freeze or faint reactions. When person freeze, it's not good for surviving, of course. That's why we tell about imbalance, and this demonstrates that actually we need in all situations fine control for balance between sympathetic and parasympathetic neuron system. Let's return to receptors. I told you about the receptors in sympathetic neuron system and demonstrate that different receptors lead to different responses. Similar with parasympathetic neuron system, we have different receptors for acetylcholine, and they realize different responses. First of all, two main groups, it's nicotinergic and muscarinergic receptors. Nicotinergic placed in ganglions, and muscarinergic in muscles and in glands, in working organs. But muscarinergic receptors have subtypes. You may find it M1, M2, M3, and different subtypes of receptors are used for fine control of different organs, because some muscarinergic receptors are used for inhibition, like in heart, we have muscarinergic receptors which decreased cardiac activity. Some receptors like M3 in glands, in smooth muscles, they mostly increased metabolic activity. They not activate, not inhibit muscles, but they give ability for more oxygen supply and blood supply for cells, and as a result, cells work better and produced more activity. And these groups of receptors have different regulation. nicotinergic receptors. It's receptors which blocked by nicotine, and if you're smoking, you will block your parasympathetic neuron system. And in general, autonomic neuron system, because your nicotinergic receptors in glands, in ganglions, sorry, decreased their activity. And muscarinergic receptors blocked by other substances. Most well known, it's atropine, which don't give ability for realized parasympathetic activity. And subtypes of muscarinergic receptors like M3, usually named metabotropic receptors, because they have several effects. They are not associated with only muscle contraction. I told you previously, they changed metabolic activity of cells. And we have several ways for this metabolic activity changing. Several examples you may find in this slide. It's change in production of cyclic adenosine monophosphate in cells, produced inositol 3-phosphate, diacylglycerol, and as a result, permeability of cell membrane increased production of some biological active substances in the cell. That's why we tell about metabotropic activity. And in this century, we tell about a third branch of autonomic neuron system. In your books, you may find about only sympathetic and parasympathetic neuron system, but if you're a good student on exams, you may answer and tell about 3 branches and about metasympathetic neuron system. What's this? Metasympathetic neuron system, it's virtual neuron system. They have no only one specific center. It's ganglions and neurons which placed in organs and realize autoregulation, ability for control of these organs without brain and spinal cord activity. We have metasympathetic neuron system in our heart, in our digestive system, in our sex glands, sex organ, and all these organs may work even if they didn't receive impulses from brain and spinal cord. It's very good for surviving, and it's very good for decreasing a role of our central neuron system in control for this organ. That's why we tell about autoregulation, and in some cases it may be very important. Additionally, sympathetic and parasympathetic neuron systems associate with some diagnostical role in medicine. They take part in such named referral pain. You know, for example, heart attack may lead not to pain in heart. Some persons say they feel pain in left shoulder, for example. Duodenum, stomach, if they have ulcer, if they have inflammation, they may lead to pain not in abdomen, but pain in, for example, back. It's referred pain situation when person feel pain in some different regions of skin. They think about problems in skin, but actually it's not skin, it's pathology of inner organ. That's why for good distinguish, you should know about typical placement for a referred pain in most amount of inner organs. I demonstrate in this slide this typical placement for referred pain. And all these situations associate with overactivity from sensory system. When inflammation in inner organs take place, damaging of inner organ take place, receptors from inner organs through afferent pathways send impulses to spinal cord. But in spinal cord, very intensive impulses may jumping from one cell to other, from autonomic pathways to somatic pathways. That's why, as a result, very intensive pain lead to activation of neural pathways, which came from skin to our brain, and person think that his skin have some problem zones. This is example of such jumping between two afferent pathways, one from skin and second one from inner organ. Next, what you should know, in nowadays we find many novel examples of regulation in autonomic neuron system. But most amount of these regulations associate with metasympathetic neuron system. Previously, I told you about neurotransmitters. In sympathetic neuron system, it's acetylcholine and norepinephrine. In parasympathetic neuron system, it's acetylcholine only, but different types of receptors for this acetylcholine. And in metasympathetic neuron system, which placed in the organs, it's huge amount of different neurotransmitters. You may find examples of these neurotransmitters, and this give ability for wider reactions and ability for fine control some activity of inner organs through control of this neurotransmitters production. And nowadays we try to use this activity. We may change some neurotransmitters production, and as a result, metasympathetic activity, not in all organs, but only in some of them, may change. This increased ability for fine control of our inner organs. Next reason why you should know about autonomic regulation and autonomic neuron system, it's common disorders in many types of diseases. You may see many chronic diseases like Parkinson disease, diabetes mellitus, neuropathies, multiple sclerosis, some traumas may lead to dysfunction, to problems with regulation in autonomic neuron system. And as a result, for these diseases and for many other diseases which associate with dysfunction in autonomic neuron system, patients may have common symptoms, problems with blood pressure control, problems with sweating, problems with defecation, urination, problems with sexual behavior, and this common responses, non-specific responses. It's a result of similarity between these diseases and association with dysfunction in autonomic neuron system control. Some dysfunctions may be not so common and may be helpful for find some specific disorders. For example, Horner's syndrome, you may find in this picture in a person's eyes, one pupil is more than other, and several symptoms, pupil constriction, anophthalmosis, decreasing diameter of eyeball, drooling of eyelid, decreased sweating, associate only with one half of the face. And when this happens, good doctor should find some problems in neck, because this Horner's syndromes associate with compression of sympathetic trunk on the neck and lead to dysfunction not in all organs which are innervated by sympathetic neuron system, but only our head, because sympathetic trunk send impulses from the thoracic part of spinal cord through neck to the head. Our next example of practical using information about sympathetic neuron system, it's emergency. When you find that your patient suddenly have heart failure, for example, and his heart beats very frequent, in some cardiac arrhythmias, heartbeats may be more than 200 in 1 minute, and persons suffer from this, and you should help for them as fast as possible. In these cases, many paramedics around the world used some maneuvers, like in this picture. Slight pressure of eyeballs may lead to decrease in heartbeat. You may check this on yourself after lecture if you have ability for measuring your heart rate. And as a result, you will find which pressure you should use for decreasing heart rate. Actually, it's associated with placement of some ganglions in the eyeballs, in our abdomen, like solar ganglion. These ganglions, if we compress them, may lead to activation of parasympathetic neuron system. And as a result, activation of parasympathetic neuron system lead to decrease in blood pressure, lead to decrease in heart rate, and so on. And for checking intensity of autonomic regulation, in some cases we used skin test. After placed some hard subjects like pen on the skin, you may find temporal change in color, and some persons have white color, some persons have red color, but time during which these pictures on skin disappear associated with intensity of sympathetic regulation. Normally, in healthy persons, all this changed in skin color disappeared after a few minutes, 3-5 minutes, and that's all. If it's very intensive changing with edema, with staying during 10 minutes, half an hour, it's very significant response which associated with imbalance in autonomic neuron system regulation. And for those who want to better understand in this topic, we have some sketches. It was on Sketch Medical, for example. If you have good knowledge of English language and want to better memorize, they produce some sketches for memorized main properties of autonomic neuron system. That's all what I want to tell for today. If you have any questions, you may ask me.